Take Care of Your Body by Rye. If you skew the endocrine system, you lose the pathways to self. When the endocrine patterns change, it alters the way you think and feel. One shift in the pattern tends to trip another. Keep listening to see what's next.
I hope you're smiling because it's me, Rye. Today, I'm with a very special guest. I'm with Chief of General Endocrinology at Memorial Healthcare System, Dr. Amy Aronovitz. Hi, Dr. Aronovitz. How are you today?
Good. Thank you for having me here today.
Thank you so much for being here. So, I want you to explain a little bit about endocrinology to my listeners, just in case they don't know what that word is or they've never heard about it. So, is there anything that you want everyone listening to know about what endocrinology is?
Certainly. Endocrinology is the study of different hormone systems in the body. So it entails a lot of the body's day-to-day functions, and a lot of the disease conditions we deal with relate to diabetes. In addition, patients who have disorders of their thyroid, their adrenal glands, and sometimes of their calcium or irregularities of their menstrual cycle.
Okay. Thank you so much for sharing that definition. So, can you describe a little bit about what type 2 diabetes is, in comparison to type 1 diabetes? I know a lot of people, kind of hear the term, oh, if you eat sugar, you're going to get diabetes. There's a lot of misconceptions. So, are there any, issues that you want to address or misconceptions
Sure.
out there?
Sure. So, diabetes happens when your body isn't making enough insulin to keep the blood sugars normal. And there's different ways that that can happen. Type 1 diabetes often, but not always, presents in children. And it results from an autoimmune cause where your body isn't making insulin anymore. And so our bodies need insulin to live. And so that's generally treated with insulin therapy. On the other hand, type 2 diabetes is a little bit different. It tends to have present more often in adults, though occasionally in children. And it's a disorder more of what we call insulin resistance. So in this situation, the body, at least initially, is making insulin, but it's not making enough to keep your glucose levels normal. And many times there can be a genetic predisposition to having type 2 diabetes.
So, genetics plays a big role in it.
It can,
That makes sense.
but also lifestyle. So it kind of, it's a combination of those factors. So it's not all just one, but it's a combination of genetics in conjunction with lifestyle.
Are there any lifestyle habits an individual can change? Let's say they're in the pre-diabetes section. Can they do anything?
Absolutely. And that's a great way to kind of shift that risk over time. And so we really recommend in that situation making sure that you're eating a healthy diet and having regular exercise. When we look at the population, it's presumed that about 1 in 3 people have prediabetes. And
Wow.
one of the biggest goals with that is to lower the risk of developing diabetes. And so we know that a healthy lifestyle through the things that we eat and how we move can cut back that risk up to 60%.
So nutrition and exercise plays a big role in that, which I'm an advocate
Absolutely.
for. So I will agree with you on that
Absolutely.
anyway. So going into actually my next segment. So I know in your office that you have the nutrition chart with the plate. Do you want to kind of elaborate a little bit on, what that is to my listeners who've never seen that graph before?
Absolutely. So when we think about dietary changes, these are really long-term lifestyle changes. And I think it's important that we have tools that can make sense on a day-to-day basis for people. I think it's really important that we think about the construct of our meals and making sure that we have the nutrition that we want in it. So most of the time when I look at a plate, I tell people to divide the plate in half. half of your plate really should be comprised of vegetables. Normally, that would be about 2 servings, and then a lean protein source in 1/4 of the plate or in a quarter of it, and then a complex starch in the other quarter of the plate. I think it's important that we have balance, but I think thinking about the plate is a very good tool in order to think about building that construct of a healthy meal, making sure that we're getting the nutrients our body needs throughout the day.
I absolutely agree. So, are there any tips you have for, maybe teenagers or young adolescents who tend to, be in college or have a busy lifestyle when it comes to healthy eating as an endocrinologist?
Yeah, I think that it can be difficult. I think trying to limit sugar sweetened beverages becomes important. Making long-term healthy decisions. If you're eating in a cafeteria, which a lot of students do in a college environment, really taking your plate and following that plate method is really useful because a lot of cafeterias will have salad bars, and so really utilizing that for half of your plate, and that gives you that construct for the rest of the meal as well, can be quite useful. Having simple things on hand, if you have a refrigerator, I always tell people, grab me vegetables or things that are a little bit easier. So that could be things like bell peppers and those baby sized bell peppers, carrots, celery, frozen things like broccoli or edamame are really nice, easy sources that are fairly cost effective as well. And really kind of lean proteins and focusing on that as well.
Yeah, I absolutely agree with you. And when I spoke to Dr. Levy in my last podcast episode, I did one with him on heart health. We were talking a little bit about, how cafeterias and school settings don't have healthy options for, students, especially like, young students. So I think that is a big thing that needs to be implemented in the world because,
I
really what we're eating plays a role.
What's interesting. So I always thought that too, except what I think it's a combination of is I don't think that, when I looked at my kids' cafeteria at their school, because I definitely was concerned about it, they actually do have healthy options. It's just if you leave kids to their own natural thing where they're constructing their own plate, they don't tend to go to those options,
Right.
or they may not look appealing to them in the way that they're served.
Right, I agree. And I like what you kind of said is like you don't have to just eat like vegetables. You can add like hummus or you can add like, maybe like a little bit of ranch to it. So it's not as boring as like just grabbing some carrots with no dip or anything.
Absolutely.
So I definitely love your approach to nutrition, and it's something that as a registered dietitian to be, I really look up to. So I think you're an amazing person for sharing that.
You're sweet.
So I know that Ozempic and Mounjaro and all of these weight loss medications are pretty popular and big in America. So since you're an endocrinologist, I would love your opinion on these medications used to treat, type 2 diabetes or even weight loss in general. Can you explain a little bit about this phenomenon and what's going on with these drugs?
Sure. So it's interesting. I'm always so surprised when it's so popular now. Medications like this have been on the market for probably, gosh, I want to say at least 15 years. My time memory may be a little bit off with that. And they were initially introduced as something that was given as an injection twice a day, and then moved to a daily injection with liraglutide, and then towards weekly injections. And it's interesting because in the initial generations of these medications, they did have weight loss associated with them, but a smaller amount of weight loss. And the ability to convince someone with diabetes to use an injectable medication was really one of the barriers. Now, a lot of that has changed with the introduction of semaglutide, which is Ozempic when marketed for diabetes, and Wegovy when it's marketed for weight loss. It's the same medicine in both of Ozempic and Wegovy. It's just that the indications for them are based on the brand name that's utilized. And with the introduction of Ozempic and Wegovy, you started to have an increase in the amount of weight loss associated with the medications, where all of a sudden, typically when a medication is FDA approved for weight loss, it's associated with losing about 5% of your total body weight. And this medication was associated in studies in people without diabetes as losing closer to 14 to 15% of total body weight. The numbers in terms of weight loss in people who have diabetes is slightly less than that, but not dramatically less. And then more recently, with the introduction of tirzepatide, which when marketed for diabetes is Mounjaro, and marketed for weight loss is Zepbound, because it has effects on both the GLP-1 and GIP, it actually has more weight loss associated with them in that range, closer to 20 to 22% weight loss.
Okay, that makes sense. So it's like some medications work best for others, and then it kind of just depends on the individual. So,
Yeah, well, and it depends, which you prescribe for people depends on various things. So it's going to depend on their insurance coverage because they're really expensive. It's also going to depend on what you're using it for. So when we use medicines for diabetes, we'll prescribe Ozempic or Mounjaro, or sometimes a similar medication called Trulicity. And when we use the medications for weight loss, that's looking at it for a different indication. And then it's marketed under different names like Zepbound and Wegovy.
that makes sense. So when it comes to these medications, do individuals also have to contribute to the lifestyle changes like you mentioned before?
Yeah, nothing works in and of itself. So I always tell people, if you're going to be successful with this has to involve a long-term lifestyle change where you're incorporating healthy eating and exercise in conjunction with the medications. One of the major benefits for the medications to help is that they help people feel full faster. And so that makes them more likely to stick with the plan. However, one of the most important things long term is that people are continuing to have lean protein throughout the day and are really maintaining weight bearing exercise and strength training. Because anytime you lose a significant amount of weight, there's a risk of losing muscle mass as well. And when you lose muscle mass, that can slow down the body's metabolism.
That makes a lot of sense. So do you want to break down a little bit about metabolism, since some of my listeners might not know what the metabolism does and how it can impact our bodies?
Sure. I'm not sure exactly the best way to answer the question, but I'll try. So during the day, our body uses energy, and it breaks down the nutrients in our body. And depending on when we take in energy, it either breaks things down and uses it right away, or it will store things in the body for later use. Now, the rate of how quickly our body utilizes nutrition or fuel really is a function of size, so how much you weigh, and your body composition, the percentage of muscle to fat. The more our bodies are able to burn more fuel when we have more muscle. And so if you lose a lot of muscle mass, even though your body may be the same size, it may not be able to burn as much fuel. And so then you don't need as many calories to sustain yourself over time.
That makes sense.
Does that answer that question?
Yeah, thank you so much.
Okay.
That makes sense. I just wanted my listeners to know a little bit about the background of metabolism, because I'm sure not a lot of them, know like the breakdown of it. So going back to the medications, are there certain individuals that shouldn't be prescribed these meds?
Certainly. Everything really is individual dependent. If you have any history of, or have had any history of pancreatitis in particular, these are not a good type of medication for you. The other big barrier would be if you had a history or or even potentially family history of a specific type of thyroid cancer called medullary thyroid cancer. That would be another instance where we would not want to use this type of medication.
That makes a lot of sense because it would do more harm than any good, correct?
Yeah, having recurrent pancreatitis is very dangerous because it could be associated with chronic pain or going on to a point where your body can't make insulin anymore. And in animal studies, the medications like these have been associated with an increased risk of this specific type of thyroid cancer. But it's a very uncommon type of thyroid cancer in general.
So is it causing endocrinologists to become kind of, inundated with patients because of these certain medications? Do you see a lot of patients that want to be put on these medications so they come into your office with the goal of leaving with a prescription for Ozempic, even if they don't really need it?
Well, so I get this question a lot from different people. So we have many people who we see who come in hoping to start a medication like this, many of which, from a health perspective, um, meet criteria. If you have diabetes, that would be one instance where that would make sense to be something to think about. And there are situations based on weight and risks for other things. So, with what we call comorbid conditions, depending on your weight, where you also may meet health criteria not for Ozempic or Mounjaro, but rather for Zepbound or Wegovy. And so I would say more often than not, when people come to see me with hopes of using medications like this, they often meet medical criteria for one or the other. Now, in primary care offices or in other settings, you may have people come in who maybe don't need these types of medicines at that point in time. And then, you worry that there may be more risk than benefit. I would say sometimes for weight control, our biggest barrier is the medication cost and insurance coverage. And then also because these medications are so widely used and popularity has grown so much, sometimes availability of it also becomes an issue.
That definitely makes sense. So, do you have any advice that you would want to give to anyone listening to help them stay in shape and kind of fight type 2 diabetes since it is an issue that is pretty widely known throughout the world?
Absolutely. I think really focusing in on having a healthy diet and making sure you're getting, normally I say lean protein at every meal. And I like people to get 6 to 8 servings of fruits and vegetables a day and really try to limit processed foods within reason. I think that's a great start. And making sure that you're exercising most of the days of the week. I always say something with aerobic exercise. So that's something that makes you sweaty, and anaerobic. That's something that's more strength training. And those, are good, healthy habits that you want to start when you're young and really work to maintain throughout the life.
Yeah. Thank you so much for joining me, Dr. Aronovitz. I really enjoyed our conversation, and I think it will bring awareness to my listeners.
Excellent. Well, thank you. I really appreciate you having me.
Thank you. Thanks for listening to this new episode of the Take Care Your Body by Rye podcast. I hope you have a little better understanding on the types of diabetes and the weight loss drugs that are out there, as well as the importance of exercising and proper nutrition. Feel free to reach out to me with any questions via Instagram, recipesbyry, or via email at recipesbyry@gmail.com. Thank you so much, and as always, with love, Rye.